Thank you for joining us this evening. My name is Gabby Pleasky. I'm the Director of Programs, Exhibitions, and Community Partnerships for the Massachusetts Historical Society. And I'm happy to welcome you, whether you're joining us in person or virtually. If you're joining an MHS program for the first time, I'm happy to extend a special welcome to you. We are actually the oldest historical society in America, dating back to 1791. We are an independent nonprofit organization that maintains a research library that provides access to a remarkable collection of manuscripts, including the papers of 3 US presidents, as well as soldiers, mothers, poets, and protesters. We hold a wide variety of programs on topics related to Massachusetts and American history for both public and academic audiences. We are only able to produce these programs and provide collections to researchers because of the support of our members and donors. We hope you'll return for future programs. And if you enjoy these programs, we hope that we can consider becoming a member or a donor. This evening, we have a really great program with 3 people who are on the front lines of dealing with the pandemic. Today is interestingly the exact 2-year anniversary of when NHS shut down and much of Boston. So it's been 2 years since we started this weird journey. At the time that we closed, I don't think anyone at NHS had any concept of what was happening or the scale of what was about to happen. Since then, almost 24,000 residents of Massachusetts have died. That's roughly equivalent of just like wiping Concord off the map, or Canton, or Acton, or Marblehead. Like it's just taking out an entire community. On a larger scale, just under 1 million Americans have died. 960,000 Americans have died. So in the not too distant future, that number is going to tick over 1 million. And that's in the context of 6 million people globally. So I think that that's just sort of really interesting to think about. Like 2 years ago, we had no idea what we were getting into. This has impacted different people in very different ways. Some communities have been just decimated, while others have faced mild discomfort. And I remember having a hard time finding toilet paper, but that was not equivalent. Some of the communities that it's just wholesale. So tonight we're going to hear from 3 people who are very directly involved. State representative and an emergency room physician, John Santiago, 3rd grade teacher, Emily Donahue, and funeral director, Jasmine Laietmark. For brief bios, Dr. Santiago was born in Puerto Rico, but mainly grew up in Boston. After college, he volunteered for the Peace Corps, serving in the Dominican Republic. After studying under a Fulbright scholarship in Paris, he returned and studied medicine at the Yale School of Medicine. He is now both a state representative for the 9th Suffolk District and an ER doctor at Boston Medical Center, the city's safety net hospital. Emily Donahue is a 3rd grade teacher. She's in her 12th year with Newton Public Schools. She's passionate about building strong classroom community that encourages student-led dialogue and cross-curricular connections to ignite a passion for learning in students. She believes in exposing young children to a wide variety of arts, authors, historical events, and cultural traditions. She holds a Master's of Education from Boston College, as well as a Master's in Communication and Rhetoric from Miami University and a Bachelor's from Syracuse University. Jasmine Laietmark had a career in fundraising and events in several Boston nonprofit organizations, working in environmental justice, transportation, equity, immigration issues, and local history before entering the death care profession. Just as a full disclosure, Jasmine and I also worked together for a number of years back in the Historical Society. She graduated from Mortuary School, summa cum laude, in 2016, and also holds a bachelor's degree from Mass College of Arts and Design. She's currently working at the Stanetsky Memorial Chapels. So just to give people a little bit of a format, each of our speakers is going to give sort of a brief description of their experience starting out. Then we have some moderated questions, and then we'll open it up for questions both from the audience joining us online and from people in the room. So we didn't actually determine who's going to go first, but Dr. Santiago, you're the farthest away from me.
Well, good evening, everyone. It's great to be here. Thank you, Gavin, for the kind introduction. To the MHS for doing all what you do. I've visited this place a number of times, actually represent the area. So it's great to be here on this panel here. I have a couple of different perspectives on this pandemic because I carry various different hats. I can recall March very vividly 2 years ago. So I am an ER doctor. I typically work 3 days every other week, Friday, Saturday, Sunday, at the City Seton Hospital, Boston Medical Center, where those communities most impacted by the virus were seen. I also happen to be a state rep in that area as well. And so when March struck, it was an opportunity for me, I think, and some of us up here to step up and to be leaders in this very challenging time. So in fact, I doubled my hours in the emergency department because I was young, healthy. And in the State House, we took a leadership position because, as you can recall, everything had stopped. Everything froze in time. So how could a state government, legislative branch, pass these important laws, provide resources when everything was at a standstill? And so the Speaker put together a group of 5 representatives, and that was one of them, a working group to devise a plan how we could vote remotely, how we could pass certain pieces of legislation to continue to work for the people of Massachusetts. So simultaneously, I'm doing that during the day, and at night, I'm going for a shift, struggling, taking care of patients, not understanding how this works. So now we have a better understanding of how COVID, from a clinical perspective, how what it means. In the beginning, we didn't know. I walked into shifts, and every shift, the nurses would say, "What's the game plan today?" Well, I don't know. Do we have enough PPE? Who's going to get infected? My colleagues are getting sick. And so I felt young, healthy at the time, so I was in there working. But I can definitely remember a couple of anecdotes, and I'll share very briefly that just stick out of my mind when homeless folks were having URI symptoms, cough, sneezing, that sort of thing. And I was like, well, I guess we'll discharge them back to the homeless shelter because they don't seem sick. And then the homeless shelter says, we're not going to take anyone. So what do you mean? I guess somebody with them in the hospital. I can recall intubated people who would no longer, unfortunately, be here. I can recall, for me, the case that sticks out to me the most when I began to take it very seriously, and I took it very seriously, was when a young person came in with symptoms of COVID, mild case of obesity, also had some asthma, but never hospitalized. But he came in, huffing and puffing, looked a little sick. I said, hey, you probably can't go home. You have to be admitted to the hospital. And I come back the next shift, and I hear the nurses talking about his mother who had come into the hospital. I said, why is his mother here? Turns out the patient is in the ICU and is on the ventilator, is getting dialysis, and he ultimately passed. It was one of the first cases in Boston where a young person passed. And for me, this completely changed everything. Being able to take better care of myself, I would go home, take off my clothes, and everyone would stuck at home. I'd go back to the ER and work a shift. Got very busy in the legislature, and I'm hopeful that over the past 2+ years, we've made some great strides in terms of medicine. We had no tests, we had no treatments. I mean, it was a bureaucratic nightmare, but fortunately, aside from we've lost a number of people, but we have a better understanding of the disease process here. We've done a better job in the legislature. So it's great to be here with you all, and I'm looking forward to having this conversation with each of you.
Thank you so much for including an educator in a classroom instead of educational experts. It's very nice to be asked to talk about our experience. I don't wear quite as many hats as the representative does. And thank you for everything that you've done. And I know just the heartbreaking conversations that you both have had to have with families. That's a dimension that I have not had to experience, and I'm thankful for what you both do. So I teach 3rd grade, and in January 2020, I was actually supposed to be on my way to Beijing, China, to be to be an exchange teacher. And about a day and a half before, it was delayed because we didn't have enough homestays for the students that we were bringing. And that ended up being because there was COVID going around in China, and families were very nervous about bringing people in. So I had left the classroom ready to go to China, and it turns out that packing for 5 months in China is actually a really great preparation for being in a global pandemic, because you have all of your medicines and everything that you need. But so I was out of the classroom for that in-between time of mid-January until about the end of February. And we were sent back to our classrooms, and we were there for 6 days, and then we shut down. And the first day happened to be Friday the 13th, which felt very, very appropriate. And so after that, we were on Zoom from mid-March until June. And it was a very interesting time because there were a lot of equity issues for students accessing the curriculum. And so we weren't supposed to teach new things, but to teach and to gather and to talk. So we had a lot of lunches over Zoom. I have a wonderful aide in my classroom who was a certified yoga teacher. So we did yoga together. So the dogs and parents were joining us. And so we were doing whatever we could to keep children feeling safe and in a very uncertain time. And when you're 8 and 9 years old, in your 40s, in your 50s, however old you are, it's very, very hard to process, but just to be so young, making sure that they felt safe and knew that they were safe was very important. And then through the summer, there was a lot of talk. Are we going to be in person? Are we going to do hybrid? Are we going to be back on Zoom? And my district went mostly hybrid at the beginning, and we did have an online option we called DLA. And that was with Newton teachers teaching students from all over the district by grade level. And but I was in the classroom every day of the week. And what hybrid was I had half of the class in person, 6 feet apart, for Monday and Tuesday. And then on Thursday and Friday, they had online work that I would assign them. And then I had the other half of the students in on Thursday and Friday. And then the students who I had on Monday were doing online work. So it flip-flopped. And then on Wednesday, we would all be together for a Zoom. And it was a lot of community building and doing social emotional learning, which has been really a strong uptick for what we've been talking about with students, and making sure that they're able to express their emotions and learn that it's okay to have a wide variety of emotions and reactions. And so that continued on until about April, but there were different iterations. And in the whole academic year for 2020, 2021, our schedule was changed 4 times. And a lot of times it happened from a Friday to a Monday instead of over a vacation or something like that. So it was a lot of pivot on a dime. We were working every single weekend, working every night, to make sure that all of the materials got to students and that all of the settings on all of the technology that we're learning as we're going. It was like flying a plane and building it at the same time. That we were doing the best that we could and doing everything that we could for the students. And when we went back in April, it was really such a relief to see everyone. And I think one thing that's been lovely is to know how excited children are to be in school, because that's, it's always the joke that kids don't want to be in school, but actually they really do. And they love being together and they love learning in person. And then this whole year we've been in person.
Thank you, and thank both of you, of course, and thanks, Gavin. I'm Jasmine. I'm a funeral director at Stanetsky Chapel. I'm working in Canton now, and it is truly an honor to be a funeral director, not just in the pandemic, but at any time, because I get to support people as they're going through some of the worst days of their life. And I'm pretty sure that many of you have had to call on people in my profession over the past 2 years. Unfortunately, you know all too well some of the trauma that I could talk about. We know that people weren't able to see their loved ones before they passed away or be with them when they were dying quite often. We couldn't then have the events that we had planned for or imagined that we could have to memorialize them. We couldn't travel, we couldn't be together, we had to quarantine, we were sick. So my heart does go out to those of you that lost someone that you love during the past 2 years. And I'm thinking that it's probably most of us that did that experience. During what we in the funeral profession call peak of the pandemic, I was working in Brookline, and Stanetsky Chapel, where I still do work, has been a part of the Jewish community in Boston since the late 19th century. And we, as a Jewish funeral home, are quite different in a lot of ways from most American funeral homes. And like all funeral homes and all cultures through history, we've had to adjust in times of crisis. So I can illustrate one example of a way we had to adjust. In Jewish burial, return to the earth is very important, it's central. And the final kavura, or good deed that you can do for someone is to, the final mitzvah is called kavura. And what this means is that the friends and family of the deceased will bury this person by hand with shovels themselves. And this is a good deed that is likened to tucking someone into bed one last time. And it's an act of loving kindness that that person cannot repay. They cannot do the same for you. So as a casket is lowered into the grave, as these shovels full of earth land on that casket, there's a loud sound. And this is a noise that is resonant with the reality of that death. It is a part of the grief process, a part of the healing process for many people throughout time. It's an ancient ritual, and it's something we respect and something we want to do for everyone. But of course, this is something that we couldn't do at all for very many, many people during the last 2 years. We also have had to modify it greatly. You know, it didn't matter if the person was young or old or super religious or a veteran or a Holocaust survivor. These rituals had to be adjusted. And we did that for the health and safety of the living. So we had to behave based on the best guidance that we had at the time, and it shifted a lot. During a normal year, and I'm not even sure what that is now, we were saying, but during a normal year, the work of a funeral director or funeral professionals is quite challenging. I think you probably realize we don't close. So 24/7, there are funeral professionals ready to take your call and be present with you as you experience a loss of a loved one. We should be, empathetic, compassionate listeners and counselors. We have to be expert event coordinators. Everything's pretty high pressure, and something like a typo in a register book or an obituary can be traumatic for people. We're also specialists in body care of decedents, and we've had to learn a lot of new skills over the past couple of years. I was just joking also about live streaming. We're now like videographer experts on top of everything else. And that's been really great, actually. That's one of the things that we adjusted that has really helped bring people together. But during that peak, when I say peak, I'm referring to April, May of 2020. That's when in Massachusetts, following Washington and New York, our death numbers skyrocketed. So that meant for funeral homes 2, 3, or 4 times the volume of people we were working with, families that lost someone. That also meant, of course, we had to take that many more decedents into our care. So we had to adjust how we were able to shelter people. And that was as the cemeteries and crematories were also working overtime. We were facing, or many funeral homes were facing, shortages of things like caskets. We only use wood caskets, so we actually do work with a local casket maker in Western Mass. So we were okay, but everyone was working long, crazy hours. That was related to the funeral industry, of course. We were also short on PPE, of course, gowns, masks, gloves, things like that. So funeral homes shared and helped each other out a lot. But it's not like we could hire more staff. It's very specialized work. So that was another issue. We just worked really early in the morning till really late at night in these very heartbreaking and just like high pressure, intense situations. So it was hard on us physically and mentally, but it was an honor also. We were going home and afraid to bring home the virus as well to our own families, and we weren't sure how it was transmitted at the start. So it was a scary time. We are absolutely exposed to the virus as frontline workers because we're the workforce that goes into the places where people die. We go into hospital morgues, and that includes the makeshift morgues. I don't even know if that's what they're called really, but the morgues that like you saw on TV. We went into nursing homes, residences, the people who were living in those spaces. They also could, of course, expose us to COVID-19. We had contact with the decedents, of course. They could still expel active virus, especially as we were transporting them, shifting them, dressing them. And the embalmers during this period, of course, were even handling a lot of different kinds of medical waste devices that they had to remove from airways, things like that. But they were working to prepare people to be seen one last time by their loved ones before burial or cremation. Really important work. We continued to go to work this whole period, and we were exposed that way as well, even though the services were small, but the people who were then able to attend funerals were interacting with us each day. And as we had to adjust during these times of shifting protocol, we really felt the importance even more of these rituals, memorial events, and being surrounded by a loving community. So as we go through this collective grief together, those elements are really going to help us.
Thank you. Thank you all. I mean, this is really horrible but amazing stories. So looking back at the last 2 years, do you guys have any sense of what we learned? Was there anything positive that came out of this? Were there things that we did learn? But also on the flip side, do you have thoughts about what was lost and what might be sort of irreplaceable that came out of this period?
Sure, I can go first. So I think a couple of things. I mean, I think we've learned a lot. You know, I tend to live my life as one is, you know, failure as a way to broaden oneself, to mature, to grow. And I remember the first couple, maybe in March, I wrote an op-ed in the Boston Globe, lessons that we can take from this pandemic moving forward. This is an opportunity to address some of the equity issues that we knew, many of us that have been in the game of health disparities, fighting for equity, that we knew would get worse or be exacerbated by this pandemic. And so this essentially took the top off that and allowed people to see that who were not paying attention in the first place. And so whether it's at the legislative level, at the local level, or even in the hospital, making sure that we're aware of these issues when it comes to equity, not just with respect to COVID-19 and health, but also the way that health impacts every facet of life. I'm a big believer in what we call the social determinants of health. That so much of what we do in our outcomes are predicted about where you live, where you go to school, if you have access to education, transportation. And so the opportunity to discuss this through an op-ed or on the radio or interviews or on TV, whatever, discussing that, we're all connected. And I think, people woke up to that idea. And so we talked a lot about that. I think we learned a lot of medicine. As I said in the beginning, we had no idea, quite frankly, what to do about this. I remember when we had the first test, you had to call DPH to get approval to do a test that would come back in like 7 to 10 days after being sent to Utah. So you're on the phone calling a bureaucratic person saying like, hey, who's not mission? You need tests. And now we're in a place where we feel a lot more comfortable. Someone comes in with COVID, they fit the criteria, we give them remdesivir or steroids. In the beginning, we had no idea. If you can recall, in the very beginning of COVID, from a clinical perspective, we were told to intubate early, right? We were told to not give steroids. We were told to give hydroxychloroquine sometimes. Now we do the exact opposite, right? And so science is, as you said, you're trying to find it. It's about learning, and I think the challenge was trying to express a scientific method to the community, because the community wants short, easy answers. They want a Chipotle menu, right? It's just like sweet, white, beef. It's much more complicated than that. And when it comes to loss, we lost, 1 million people countrywide. Millions of people across the world. And I think, and what I'm concerned about is just I go to the hospital now, and people are just tired and burnt out. And people have left. In the last couple of weeks going to the hospital, I don't even recognize the nurses because many of them have left. And they're new. And I think the stress that clinicians were under, clinicians are a higher risk for depression, anxiety, suicide. This obviously exacerbated that. And much of the workforce is recovering anytime soon.
So I think we saw the power of unions and how they were able to protect a lot of us on the front lines. And I hope that was a wake-up call for America, that they helped to build the middle class and gave us a 5-day work week and are there during times of crisis when we need a collective voice. So I was very thankful for my union. And I also think that we saw that schools are Band-Aids for a lot of social issues. For food insecurity, we feed children every day. For abuse at home, we recognize it and report it. And I think that we saw that when school shut down, employees still went and helped serve meals and give grad bag lunches because the families needed the food. And so I think the food insecurity has oftentimes been covered by a veil of shame. And when it was suddenly affecting so many more families, that veil was dropped, which I think was very good that people ask. And it was a no questions asked policy. Here's a bag lunch and here's some dinner as well. And so I think we need to do more of that. I also think that we need to examine the structures that our buildings are for educating the youth of America. They're crumbling. And we found that out when we had to go back and the ventilation wasn't up to par. So I think that we need to invest more in education because it does build the future and it also helps to sustain the current. I do miss field trips. That's something that's precious. I'm looking forward to being able to go back to field trips. Plymouth Plantation might be calling our name. It's very exciting. So I think that that will be exciting when it comes back. So I don't know if anything is permanently lost, But I second your compounding exhaustion. I think anyone who has been in person in the last 2 years and has had so many changes forced upon them, it's exhausting. And when you get more bad news, like our district just announced that there's going to be a lot of layoffs, and that is so hard after 2 years of working all hours to hear that your colleagues could be gone after all that they gave. And again, it's a funding. We need to fund education. We need to fund healthcare. We need to fund these social programs and to help build our society. But I do worry for, similar to how you said nurses and doctors are leaving, I think it's going to be around the corner that teachers are doing that too, because we've had just 2 years of nonstop changes. And I have always loved change, but it's always been on my own terms. And so when change is forced upon you, it's exhausting. And it's hard when you are feeling so tired and you have to then go in front of children and genuinely be excited about what you're teaching them. The distance between where you are for energy level and where it has to be a meaningful experience, to reach that takes a lot of energy. And I can't imagine that many people who are in high school and college are looking at how teachers are being talked about by national and local politicians and families, that they're going to want to go into this profession. So I think that there's going to be a dry well very soon of talented educators. On the other hand, my community has been amazing. Our PTO has been so supportive, and I feel like parents are bending over backwards and so thankful for all that we are doing, and they're expressing it, and that just means the world. So I think telling people what they mean to you is something that is precious that came from this, because we know that someone can be taken from us in an instant, and we don't have to wait for a special moment. We just need to tell them in the moment. And I think that the here and now is something that is very important that we've awakened to.
Something that we knew, well, many of us thought about more than others, was that we live in a death-denying culture, and maybe the most death-denying culture in the world here in the US. And what that means is we value vitality, youth, individualism more than anything else above all. And that does not make for a society that cares well, is known for caring well for our elders. Now with the pandemic, more people had more awareness, more conversations were happening about not only the resilience of our own bodies, but the fragility of our physical bodies, the fragility of our systems, and being able to get things that we're used to getting. People could disappear in an instant. It just became more, people were a little more aware of things that they had taken for granted before. It has not been pleasant for most people, right? So, but something that came out of it was more conversations that weren't happening before. So in this death-denying culture, we're starting to see more conversations about end-of-life care, really important things to talk about with the people that you love, and should you not be able to make decisions for yourself when it comes to the end of your life, or if you're sick, then it's good if you're communicating ahead of time with people about what your wishes are, what your priorities are, things like that. So I would encourage everyone to go ahead and do that, and more people are, and I hope it continues to go in that direction.
in each of your careers in different ways, you've had to deal with grief on a different level in the past 2 years than in previous times. And I think that part of that has to do with sort of enforced distance, like saying that a family member can't visit a patient who's in serious trouble, or students who are living remotely and can't be in person, or people who can't attend an actual funeral. So can you talk a little bit about what it's been like, for you personally, to deal with this increased level of grief in processing, and how you've handled it professionally?
Sure, it's a challenging question because my profession pre-COVID was always about this. When someone comes in who's been shot, and you have to save their life, do your best to attempt to do so, see what the outcome is, talk to their family. And so ER physicians, by their nature, they have to compartmentalize, right? Because someone comes in who's been shot, and then literally 20 minutes later, another person comes in. And 20 minutes later, someone comes in for foot pain who's been there for 5 years, and they're like, why are you here? And then someone gets shot again. So or someone has a heart attack or stroke. And so by our nature, I think we have to, and there's a part as a physician where, I'm a big believer in talking and strong communication with your patients and empathizing and crying with your patients. But you can't do it all the time because it weighs on you. You think in the beginning of the pandemic, it was just so much so fast, and my schedule was, as I mentioned, I doubled my hours in the ER. So I did Friday, Saturday, Sunday overnight, and I would flip, go Monday, Tuesday, Wednesday, Thursday, legislative, and then flip back. So 4-3, 4-3, overnight day. It was exhausting. And so I was just kind of focused, but I think this was an opportunity. I considered it a privilege to be on the front lines. I think I got into medicine because of what was happening in my community. I got into medicine because my uncle was infected with HIV and died of AIDS. And so when I hear about the stories that occurred early on in that epidemic, and about scared to go to the hospital, and I always said to myself, well, if I have an opportunity to do something like that, I'm going to do it. And so I looked at this as an opportunity to stand up and be a leader. And many mistakes were made along the way, very tough conversations, and burned out. And remember, the first surge was in the second surge. I also got appendicitis. I got deployed in the Army. I was in Kuwait for a while. I came back. I had to run for mayor. I mean, it was all over the place. And, my wife got pregnant. We just had a kid. And so it was a lot of ups and downs. But I just, the ups being my child, of course. But I think you just, commitment to service, like all of us here, right? Many of you. And, the world is much bigger than what's happening in your household and in your community. And I think the opportunity to serve is what just keeps me going and what keeps me hopeful amidst what's happening in Ukraine, in the Middle East, in our communities, still thousands of people dying from COVID. And just this kind of, attempt to just build resiliency through hope is what I strive to do, at least.
Have you ever been told you're a tough act to follow? You've got a lot of things going on. It's very impressive. So I think the overarching idea that I've seen is fear, and it is shown in so many different ways. It can be shown at a school committee meeting when a parent says something terrible. I know that's coming from a place of fear. A student who's scared about a new change that's coming may be hyperactive or much lower key or just crying. So you can't really predict how children are going to express their fear, and they're most likely not even recognizing that it's fear. So giving tools of how to communicate about that is very important. So I think the change of social emotional learning, or the uptick of social emotional learning, is going to benefit this generation so much, because they're able to share their feelings, where for so long, I think Americans were just taught to be put on a brave face and move forward and not talk about your emotions. But what happens is that it bottles up and then you explode in your own way. And so from getting these lessons early on, I think we're going to have a much healthier, emotionally healthier population in the future, because they're going to know how to ask for help. They're going to know how they react to fear and worry. And I have to say that the last couple of years, I've had some of the most kind students that I have ever had. And I think it's because they see suffering around them and they see people hurting. And so their emotional quotient has really just gone through the roof. And if a crayon is dropped on the floor, 10 people jump to try and get it because they want to help that person in their third grade time of need. And so I also have a lot of students coming up to me saying, I noticed so-and-so looked upset. You might want to check in on them. So there's a lot of knowing who to go to and wanting to be there for others. And that's really heartening. As far as the physical contact, yeah, I think that's really hard for kids. That there's a little bit more on the playground now, but when they were 6 feet apart, just even having a conversation about a math topic can be very hard to be 6 feet away from each other. So so our district just went mask optional on Tuesday, and it's really been interesting to see them react to the nonverbal communication that they're now getting. So we had to have a talk about, so you're going to see a lot more facial reactions that people were hiding behind their masks. That might make you feel uncomfortable. Just have to go with it and go with the flow. We had to talk about how to sneeze properly in a group, because the last time they had to sneeze without a mask on, they were first graders. So it's been a really long time since they've had to do some social norms that we take for granted. Even just like talking to stranger adults isn't something that happens for young children. So the casual, I'm bringing my child to the grocery store to pick up a few things. We run into a neighbor or they say hi to the cashier. They're not getting that. And so when they come across an adult who isn't their parent or isn't their caregiver or isn't their coach, they don't know how to talk to them. So the first part of the year, I had to stop this child who, anytime I asked him to stop talking in the hallway, school rule, everyone has to follow it. He'd go, what? Like I was an umpire making a bad call. And I had to have a discussion with him about, that's not how you talk to teachers, right? So just that there are gradients of how to speak with other people is going to be a big learning curve for them. But I think they really are coming from a place of empathy that previous generations just haven't. So I really think my core of 8 and 9-year-olds are going to be just fine. I think it might be a different story for middle and high school students who have missed a lot of very important social learning that is really pack mentality. And before this, I was actually worked in colleges and universities, and that's another pack mentality time of your life. And when you've had to be separated from that, I think that's going to be really, really difficult in the future to navigate those friendships and building relationships with others when you haven't had that training when your brain growth was in that moment.
Well, what you were saying, Santiago, about the rapid succession of patients in the ER really resonated with me. I was brought back to having, 3 times as many calls in rapid fire coming in the morning to know we had a lot of calls overnight. That was a higher volume of families to interact with, and we couldn't let them know. Each one had to have our full attention, right? And we weren't doing arrangements in person anymore. So yes, services weren't in person, but arrangement conferences are pretty important in the funeral process, where usually we would be meeting with families in person. We were doing a lot of that on phone, online, and that was great that we were able to use the technology to do the work we needed to do to make sure that everyone was safe as we made funerals happen, and burials and cremations. But we were missing this in-person interaction at a very intense time where you pick up a lot on body language, right, of people, and especially if you're trying to meet them where they're at, which is what we try to do, because everyone grieves differently. So eye contact and picking up on signals for people are very important. It's important to me that people feel comfortable asking whatever questions they have during that process, and it was a lot harder to do that during the pandemic. So we've been meeting with people a little more often now, and it's really nice, even though I can't see the bottom of their face.
Okay, so I think we have one more question from me, and then we'll turn it over to the audience and the online audience. I think one of the things that's been very unusual about this disaster has been it became political very, very quickly. And I think we all, luckily for us, live in an area of the country that's relatively progressive. But I would imagine that in your professional life, you're running into people who aren't necessarily agreeing with you. And I wonder if you can talk a little bit about what it's been like to have to deal with these political discussions while also dealing with this pandemic, and how the isolation from the pandemic, I think, has led to polarization to a much greater degree. So just wondering if you have some reflections on any of that.
Sure, I think, we lived in a polarized age, and I think, being that we are in a historical society, if we read history, we're always kind of in a polarized stage, right? It always feels more intense when you're in it, right? When you're in the battle, when you're in the ER, when you're in with a patient. And it's challenging for sure. And I think what's been frustrating about this is how the science has been so politicized. And I think as I referenced earlier, I think, when you're communicating to the public at large, I think the goal is to kind of simplify the message, but as you do in the Army, for the lowest common denominator. These are somewhat technical issues that many well-educated people are having robust discussions that are debatable because the science isn't there. And so when you look at a reason why people take an aspirin or a lipid-lowering agent, and just because thousands of studies have been done to suggest that we should move forward in this direction. And that's not happening this time as you're building the plan, as you're flying it. And so it's been incredibly frustrating. I think look at just clinicians. Early on they were applauded, and teachers, right? And then later on, you became the devil in some respects. And so it's been frustrating, and I think because of the politics of we live now, and I think the isolation has worsened than that. People on social media can say whatever they want to say. And this is why I'm asking elected official to put that on. I try my best to put social media in a box. And I think people, when you meet with them, conversation with them, you can break through that isolation. And people aren't as stubborn or aren't quick to judge if you do it in person. So I think my political practice, at least, is to be out in the community when it's safe to, obviously. Have these conversations, or if someone sends you an email that says, I disagree with you. I got tons of emails, calls, and you're a communist and socialist if you want us to wear a mask and all this stuff. And when I know that it wasn't me being a scientist, me being a politician, but me being a scientist and a physician. So it was challenging, but that's part of the process. And I think when I review history, my little we're always kind of in that battle, and searching for truth and fighting for that. And I think the ebbs and flows of that, I think that's what's been challenging. And obviously, this is a particularly challenging time in American history.
So, as you mentioned, teachers were immediately put on a pedestal when daycare was suddenly taken away, and parents saw their children in a new light. And all of a sudden it was, teachers should be paid $1 million and every day, and they're so wonderful. And then just a couple months later, it was like, go back and do your expletive job. And it was a hard fall because we did not ask to be put on this pedestal, and it was demoralizing and very hard to go back. And when you were scared about being in close proximity with people who were nowhere near being able to get vaccinated, and we weren't vaccinated either. So like I had said earlier, fear is a very interesting feeling. And I think that fear and anger are kind of a razor's knife edge away from each other. And oftentimes anger is just fear masked. So I haven't seen a lot of it personally. I think that my superintendent gets a lot of that. I think my principal gets a lot of that, but I think that teachers have, at least in my community, have largely been shielded from the direct emails that you've received. It's been interesting to see the spectrum of how people in your own building feel with the comfort level of a new change coming up, but then also respecting each other for that. We went mask optional. A lot of teachers were comfortable, a lot weren't. So some of us are masked and some aren't, and the same thing with children. And so I think that understanding is a beacon of hope in this little microcosm. I think that we have learned that leadership matters and that voting is very important, not just on a national level, which we can see makes a very big difference, but on the local and state level. Having an excellent state rep is a very important thing, but also your school committee members. I think we can see across the nation as we see different bills coming into what can and cannot be talked about in certain states, shows you that voting matters, and who is making the decisions of what education can be in your community matters. So when you go to the polls, make sure you know who you're voting for instead of just checking random boxes, because they have opinions and they will take them very far. And so I think I am very worried about the communities that are excluding people and topics from education and flat out banning it. That's very, very concerning to me. And you know, you're one election off. You look at Virginia, and one governor difference with a very tight election makes a big difference than what my friends that are teachers in Virginia are beside themselves with the changes. And we have a gubernatorial election coming up. And so who the governor is matters. And we've been very lucky that we've had a strong leader in our governor, and we need to make sure that we have another strong leader. And so I think that that was something that I had taken for granted, being in a fairly liberal and progressive state and school district, that one election can change everything. So how political education and learning is really staggering. And I think that we need to make sure that we elect people who are aligned with science and truth.
I kind of smiled to myself. I don't know if I'm morbid or weird, but when you brought up the thank you first responders, and you know, it's doctors, teachers, bus drivers, all awesome. Actually, it was really wonderful when that was happening, and it should continue. Funeral directors are never part of those lists, and it's, you know, I kind of giggle because you know, we're just not. It's like I said, the death denying culture. So of course we're not. We're never really part of those kinds of lists, and it's fine with us. We're not doing it for the recognition, and we're totally used to it. So one way that this manifested that wasn't really very okay was during the vaccine rollout. And I say this knowing that the head of the Vaccine Advisory Board is coming to speak here in this series. But no, I really do have a tremendous amount of respect for the Vaccine Advisory Board. I know, well, I really don't know, but the enormity of the task that they had. They are public health experts. There was an emergency situation, and that is why there wasn't a lot of room for feedback or input during that process. Some of you may know that funeral directors were not grouped with healthcare workers or teachers in the rollout of the vaccine. We weren't grouped anywhere. We were in with the general population. And as I told you earlier, we were definitely right on the front lines with the virus. And there's a great article in the Worcester Telegram that kind of details this scandal. And also the scandal that the medical examiner staff who were also in contact with decedents were vaccinated earlier. And when the Massachusetts Funeral Director Association, organized some of us, and we talked with our elected officials, brought this to people's attention. Representative Cairns and Senator Goby did compose a letter, and we asked why, just why. There was no explanation for why we were not allowed to have the vaccine, and until later, which we did get. But what I think may be the only explanation is that fear of death to the point of denying that we even exist, total unwillingness to even acknowledge our work, which was hopefully not going to happen again. And I know, Representative, you're on the committee for healthcare. And I think that there's some bill in the works where we would be grouped with healthcare workers in another emergency situation as critical workforce.
Okay, well, I think we can open it up for questions. Do people need help? Jasmine? Are there questions from the in-person audience?
Thank you all very much for sharing your experiences. The funeral directors, you're on the front line too. And I think during this time, we've all experienced different levels of grief. Properly grieve the loved one, have those final moments. Physicians on the front line with the nurses, the respiratory therapists, the chaplains, the nurses' aides, the support staff, all are trying to do the best they can. But you leave feeling like, I wish I had more time to hold that person's hand when we jump on to the next person who's in a crisis. And just think about all the changes in how you communicate to a patient, whether speak English, Portuguese, or Spanish, or Chinese. We're fortunate that we've had some technology to help us, but even in your final stages of trying to help a family let go of your loved one, it's not the way you probably would have done it if you had had the time before you moved on to the next person. And from Emily's perspective, I think that she's very dynamic. She's seen multiple children go through all kinds of changes with situations going on at home, with families. And how do you shift gear and say, today's a new day, let's face the new day, but I want to know how you guys all build that resilience and courage to face the day what you do to support yourselves as caregivers for the public, yourselves in a positive way. Do you ever say, I have a right to feel sad, I have a right to feel tired, I have a right to say, I need to spend time with my own family without feeling like I'm being selfish, because I'm sure you all could be exhausting others.
Just for our online audience, if they weren't able to hear that, I think the question was sort of how do you build resilience and how do you give yourself time to be upset in a world that's upsetting?
The process. You've had no time to process what you just went through.
I go for a lot of walks. That is something that really, truly kept me going through the pandemic. I have a friend and neighbor who we go pretty much every day during the pandemic, and now multiple times a week. It was something that I never really did before. I would go for a run, but never just a walk, but it was feeding my curiosity, because we would find all of these little gems of buildings or architectural details along the way. And so that was, I couldn't go to museums, but I could look at cornices and trying to find some sort of substitute for what would bring me joy that, all of a sudden in March 2020 was dangerous. And so I think keeping in touch with friends has been key. I actually write a lot of cards and write a lot of letters, and when it looked like things were going to really shut down in March, everyone was going to the grocery store, and I did too, but mine was like, I've got to go to the post office and make sure I have enough stamps, because I don't know if they're going to sell out or not. So every time I write a letter, it feels like a conversation. And so that has helped me feel connected to my friends who are afar or who are close that I can't see. And so teachers are known for staying well past the hour that they're supposed to be there. And this is the first year in 12 years that I have, and it's only been the second half of the year that I have started to leave in a reasonable time, which is within an hour after school ends. And that has made a big difference. Making a hard stop a cutoff has really helped me to take care of myself and my mental health.
This is the hardest question of all.
The short answer is, I don't know. Ray got a very good job of doing that. With high speed. Like therapy now.
Self-permission to be nervous sometimes.
It's funny. I'm a new father. Child is weeks old, and we had a conversation. Many of my best friends are having their first child as well, so we have this group. We all have a young son, anywhere from weeks to a couple months old. And the question came up on a chat the other day: what kind of characteristic do you wish your son will have? And I said resilience. And I'm a big believer in sometimes people are born with certain natural characteristics, whether you're good at this or that. I'm a big believer in that you can train yourself, you can improve. And so we had a conversation about how do you create resilience? And we were talking about our own lives and perspective. And it was a challenging conversation because you've been through a traumatic experience over the past 2 years, if you think about it. I mean, some would argue that the life of an ER doctor is, you're seeing trauma. I mean, you're seeing people who are shot and stabbed, and you're seeing cases where homeless folks who've overdosed, and obviously COVID has been traumatic in my own life, and I'm lucky that I'm healthy. But it's something that I've struggled with, and I haven't done a good job, to be quite honest, really kind of pushing back. I mean, my life has always kind of been on high speed, and it was later on during the pandemic, post-second surge, I take a step back. My wife is pregnant, and the mayor's race was done, and they had to think, why are we doing all these things? And are you happy? Yes, and we will continue to do it, but I didn't want to do it to please somebody else. I wanted to do it because I wanted to do it. And I think fundamentally, I just have this desire to serve. And if we are given, God willing, 80 plus years to live on this earth, that, it will come, it will end, and I love the death denying kind of, if you don't mind. But if you could give to this world in a way that will impact generations to come, whether it's through teaching resilience to your son or being a physician to give folks a chance to live, you will do the best at whatever's in your power to do just that. So that's where I get my hope. And I think, as I kind of mentioned earlier, given what's happening in the world today, I don't want to say post-COVID, but during COVID, what's happening in our country, what we see on the news. I've been stuck on, like many of us, on CNN or whatever, watching Ukraine, the news there. And I just have this maybe unreasonable hope that things will get better. I think that's what pushes me to kind of keep on working. And sometimes at the expense of have I been burned out before? I think many physicians get burned out in residency, and I'm kind of lucky that in my residency, I can really count the number of days that I was burned out. And so I don't know why. It's not because I drink more caffeine because I don't drink coffee, or it's not because I just kept on doing it because I felt like, that's why you're here, And if you're looking to live 80 plus years, you should do that because there were people who did this, whether it's people marching for civil rights, people looking to end slavery, people looking to get the next, increase, minority admissions at a medical school. So people did something to put you in a position you went, and the least you could do is pay that forward. And so that's what, I kind of do and I take strength from.
Well, I used the phrase collective grief earlier. And what I sort of mean by that is that even if you haven't lost someone that you love, everyone is going through loss during this pandemic, and in different ways. And all of those types of loss are valid, and we need to acknowledge that everyone is experiencing a loss. It's important to acknowledge it because if you don't, then it gets even more complicated for people. And at the same time, there's pandemic, and then there's everything else, xenophobic and racist violence is still on the rise, and, things are continuing to get worse. Disparities that we knew existed already are getting worse with the pandemic too. So there's a lot going on that everyone's experiencing, and we do, it is a privilege, it's an honor to do the work that I do. And that's actually what helps me keep going in a lot of ways in this context of everything else. Self-care is very important. I haven't been so great at it during certain times, not just during the pandemic. I mean, it's tough. It helps to have a supportive people at home to help make sure you're eating and things like that. More basic than general self-care, but I'm sorry. So I was saying I'm not very good at self-care. No, sometimes the burnout does get to you, right? But what happened to me this year, January 1st, 2022, is that a coworker of mine suddenly died. And that was horrible. 2021 was a pretty stressful year for all of us. And I think, though this person in my life did not have COVID, it seems like, maybe stress and not having access to medical care because of COVID caused this sudden, horrible death. And that sort of kick-started me into taking better care of myself for real. So sometimes you get jarred into taking better care and really embracing people around you.
I think you bring out an important point that we acknowledge in the public that because of all of the stresses going on between the pandemic, I think the lack of true respect for all of you in the public arena, taking care of patients and their families and their children. What do we do to support mental health? And I think there's a significant issue, I think, of burnout in healthcare workers and healthcare providers and support services and funeral directors and their support staff. And we need to really look at that because I think the mental health in our nation is in trouble. And I think there's a lot of acting out behavior as a result of people just saying, I'm done with this, let's move on, and be very frustrated that we can't do this, can't do that. Yet, not enough people to have diagnosed, because I think part of the problem is people are not processed. Everything they've experienced still is coming sideways in all directions. And it's like a hornet's nest.
I want to be conscious over time because we're a little bit over time. Olivia, do we have one question from online to ask?
Yeah, going on off of what we've been talking about, Nicole was asking, what ways do you think our communities and the nation should realize these great losses without just moving on and missing the opportunity to learn the important lessons that hopefully will serve future generations?
So the question was, how should our country memorialize the losses?
I have a feeling that the children that I'm working with now are going to be, and younger, are going to be called the COVID generation. I think that there's so many different things that we can't even imagine right now about, loss of nonverbal communication, loss of random contact with neighbors and friends. I think that's going to have a long-term effect that we can't necessarily predict the path of. So perhaps the way that I'm called Generation X, then that will maybe help people think about how much time has passed as that generation goes, if that is what they're called.
I think we should take this opportunity to recognize what problems we have in what problems we have in our society that have been highlighted by the pandemic and throw some resources at them. I think in my context, even Massachusetts, we need we need a system for people who die but have no assets. We have a lot of people in this state who have been, systematically deprived of the opportunity to create wealth and maintain wealth. So it's not just about when they die, what happens. The state doesn't, cover their expenses. But it's a lot. That's about their life as well, our lives. So let's memorialize this pandemic by putting resources towards helping people.
Yeah, and I would agree. I would say, again, this pandemic essentially unleashed what many of us who work with vulnerable communities already knew, right? Things got worse, and many of us have been saying this is what happens, it happened. So I completely agree with you 110%. And I would you said the number is 24,000 million. Let's not let their lives go in vain. Right? Even if you haven't lost anybody, you've suffered some sort of trauma. And let's take these lessons, let's learn from them, and let's just be better human beings.
Develop a playing field and deal with the areas of care and people's access to care and build more trust.
I want to be conscious of the time, and thank you very much. This was really a wonderful conversation, but obviously very difficult. Thank you.